There is a type of arthritis called gout that has had a long and interesting history. In fact, it was once known as the disease of the rich.
It seems that there was an epidemic of gout in England at around about the time of the 17th century. Many of the important risk factors for gout were most prevalent in that stratum of society, namely alcohol drinking.
Bruce Faubert is a 53-year-old salesman, and like all gout sufferers throughout history, his illness began in the kidneys.
What often happened in Europe a few hundred years ago was that the royalty had, or the wealthy had, access to port and other wines that happened to have been made in containers that contained lead. And it turns out that lead can damage the kidneys, causing you to retain uric acid.
Uric acid is usually excreted from the body in the urine. But for reasons not completely understood by scientists, gout sufferers retain too much in their body. The excess uric acid is carried by the bloodstream throughout the body and settles in the joints, usually the foot or big toe. There it forms into microscopic needle-like crystals that inflame the joint and cause severe pain. The buildup generally occurs slowly over time. But once enough uric acid has collected, a gout attack usually happens very quickly.
It comes on suddenly, so patients sometimes go to bed feeling well and they wake up in the middle of the night or in the morning with a red hot, swollen, painful big toe.
The night that I finally really got gout is I woke up and my foot was throbbing. It was like a toothache. I had to take the covers off it. The actual covers hurt the foot. I couldn't put the foot down on the floor. I kind of had to hobble around, and even that was sore because your whole foot's swollen and red. It feels like somebody actually hit your foot with a sledgehammer. That's how bad it is. And I thought I broke it, but I didn't know what I did to break it.
Bruce visited Dr. Robert Yood at the Fallon Clinic in Worcester, Massachusetts. He presented with classic gout symptoms. To confirm the diagnosis, Dr. Yood performed a test that very easily diagnoses the disease, removing fluid from the affected joint.
Far and away the best and most reliable way to diagnose gout is to drain some fluid and look at it under the microscope, because you can see the sodium urate or uric acid crystals under the microscope and make an absolutely definitive diagnosis of gout.
Gout affects 2.4 million Americans. Although it can't be cured, it is the most treatable form of arthritis.
Well, when I have an attack coming on now, I actually get a little soreness in my big toe, but if I start taking my medication, it normally knocks it right out and I'm fine.